Hi, welcome to the NIDEK talks. I'm Susanna Park. I'm a retina specialist at University of California, Davis. And today I'm going to share with you our experience using the non-mydriatic fundus photography for diabetic retinopathy screening. Now, the method that we're going to talk about mostly today is the store and forward method of teleophthalmology, where you take the fundus photos, store it, and transmit it electronically to a remote retina specialist who can interpret the findings and triage the patient as needed. We have done several research projects on the usefulness of this technique. Last year we presented at the Academy a poster reporting on the diagnostic value of this type of screening for diabetic retinopathy when used at UC Davis versus the California Indian Health Services. This year we have another poster at the Academy looking at the effect of screening and triaging using store and forward teleophthalmology on compliance to follow-up dilated eye exam, and how the findings on follow-up eye exam correlates with the findings on fundus photography. So as you know, diabetes mellitus is a very common condition affecting 16 million Americans at present time, and there are 800 new cases diagnosed every year. Diabetic retinopathy is the leading cause of blindness in the working age adult population, and by 2050, they're predicting that there'll be triple the number of cases of diabetic retinopathy in the US. So this has become a major public health issue. As we know, diabetic retinopathy, incidence and severity correlates with the duration of the diabetes, but also correlates with how well the diabetes has been controlled during that time. If patients have other systemic complications of diabetes, such as kidney problems or renal peripheral neuropathy, the chance of them having diabetic retinopathy is also increased. And we want to screen patients with diabetic retinopathy before they start losing vision, because there are treatments available, proven treatments like laser treatments and vitrectomy surgery and pharmacologic agents that are being investigated to minimize the blinding complications of diabetic retinopathy. Now, the recommendation right now, as you know, is that all diabetic patients should have an annual dilated eye exam. But the compliance to this recommendation is poor overall. And it's not just an access issue, because in urban centers like San Francisco, where there's an overabundance of eye specialists, only 70% of diabetics actually show up for annual dilated eye exam. And this compliance is way down to 30% if you go to remote areas where there's even an access problem on top. So as we know, if the gold standard to screen for diabetic retinopathy is a comprehensive eye exam with dilation, but patients don't like to show up for these exams when they don't have individual problems because they think nothing is wrong, and they have to leave with blurred vision from dilation for the whole day. In remote areas, again, as I mentioned, there is an access problem where there aren't eye specialists readily available to do these exams. An alternative that people have explored is a 7-field stereoscopic color fundus photography. And there are some papers that have been published that this may actually be even more sensitive than dilated eye exam in detecting subtle retinopathy, because you can magnify the image and look at everything in detail, while on an eye exam you just have a few seconds to scan the fundus. Despite this, the logistics of doing 7-field stereoscopic fundus photography is pretty labor intensive. You need an experienced fundus photographer, and usually to get good quality images, you have to dilate the eye. So it's not usually used in routine diabetic retinopathy screening. As an alternative, more cost-effective and easy to implement screening technique, various companies have developed, including NIDEK, has developed a 45-degree single fundus field photography that you can get without dilating the eye. And this has been used in several centers to screen and triage for diabetic retinopathy. The main advantage, no dilation needed. Minimal training is needed. I mean, I've used these cameras myself. I'm not a very good photographer, but I got pretty good images at the first try. So it's very easy to use because there's an autofocus capacity. So you get good quality images with minimal training. These images are digital, so you can store it and send it to a retina specialist by email or other electronic method, and they can evaluate the images and recommend treatments. So this is an example of a 45-degree fundus photograph taken with one of these non-mydriatic fundus cameras. This particular one was the one made by NIDEK. And you can see with a single image, you can get a pretty good view of the disc and the macula and the major retinal vessels. In this particular image, you can see the subtle hemorrhages, cotton wool spots. So it's a very good image. And these cameras are 10 megapixel images, so you can even enlarge it in your computer and look at things even in more detail. As I mentioned, the reason we like this single central 45-degree image is because the camera can focus automatically. If you want to get peripheral images, you usually have to manually focus, which makes it a little more difficult to get good quality images. But with this camera, if you want to get peripheral images, you can. It's just technically it's a little harder. You can even get stereo images by getting pictures at it from a different angle, but again, it requires a little more technical skills to do that. So these are some of the changes from diabetic retinopathy that you can diagnose with a single 45-degree image of the disc and macula. Here is a patient with some exudates. This is not clinically significant yet. It's too far away from the fovea. But this patient has exudates extending to the fovea with some microaneurysms. And although you cannot appreciate macular edema, you want to send such a patient to an ophthalmologist promptly to evaluate for clinically significant macular edema. You can also see changes like retinal neovascularization. This patient has florid neovascularization of the disc, which again is not very subtle in that particular image. So the goal of store and forward teleophthalmology is to increase the compliance to screening for diabetic retinopathy. So you're basically using this technique to capture patients who haven't been compliant to the annual dilated eye exam. And using this technique, you can increase the rate of diagnosis of diabetic retinopathy, you can pick it up early, and you can apply treatments before the patient starts losing visions. This fundus image can also be used as a method to screen for glaucoma because you can assess a degree of optic nerve cupping in these pictures. And if there's media opacity suggestive of cataracts, you can also refer the patient for cataract evaluation. So what are the limitations of a single 45-degree image of the fundus to screen for diabetic retinopathy? Well, as I mentioned earlier, with a single image, it's hard to get stereoscopic views. So to evaluate for macular edema, definite macular edema, it's hard to do. So you can only look for secondary cues like exudates and MAs. You have limited view of the fundus unless you dilate the eye, because to get peripheral images, often you have to dilate the eye and be technically a little more competent. And so if there are lesions in the peripheral fundus like a choroidal nevus or NBE elsewhere, you may miss it. Again, the quality of the image determines how diagnostic the screening is. If your technician isn't very patient with the patient and devoted to getting good quality images, the evaluator cannot evaluate the image. If the patient has cataracts or dry eyes that affect the clarity of the media, again, the quality of the images may be compromised. And other limitations which are obvious to us ophthalmologists is that you have no view of the anterior segment. So here's a picture of someone with florid rubeosis, and you will miss that just looking at the fundus. Some of these sites have eye technicians who can also measure vision and intraocular pressure